Good morning. I'm Councilmember Jim Graham, Chairperson of the Committee on Human Services. The time is now 11:15 on Friday, February the 10th, 2012. We're in room 500 of the historic John A. Wilson building at 1350 Pennsylvania Avenue Northwest to conduct a public oversight hearing on the FY 2011 and year-to-date FY 2012 performance of the Child and Family Services Agency, which will be referred to throughout this hearing as CFSA. I notice that we still have this delayed volume. I don't know how it's working with the transmission outside of this building, but it is a little awkward to have this delay in the transmission. It's been going on for some time. I hope they'll get it fixed soon. So this hearing will provide an opportunity for the committee to review the work of CFSA over the past year and to support additional improvements in the coming year. Additionally, the agency will have an opportunity to share with the committee and the public how the child welfare system, which we are continuing to build and reform, is working toward fulfilling its mission to improve the safety, permanence, and well-being of abused and neglected children and to strengthen families in the District of Columbia. There have been notable progress. We will be receiving testimony today from the Center for the Study of Social Policy, CSSP, the federal monitor of the class action lawsuit LaShawn. CSSP is responsible to the Honorable Thomas F. Hogan of the United States District Court to provide an independent assessment of the district's compliance with the outcomes and strategies of the modified final order in its most recent update, the LaShawn Implementation and Exit Plan, developed in December 2010. Testimony today will provide an overview of where the progress is in meeting the 51 exit standards outlined in that plan. Now let me just say some things about what I think some of the priorities need to be in the year ahead, and some of the priorities against which we should be evaluating the agency's performance. First, we must focus on ensuring the availability of services, programs, and supports to prepare youth aging out of foster care for the challenges of adulthood. Without adequate preparation, these youth may very well face dire consequences, including homelessness, incarceration, unmet health needs, and further reliance on public assistance. I believe that employment and jobs is vital to combat these outcomes. Just this past week, I introduced a bill that will provide a 10-point hiring preference for CFSA foster youth between the ages of 18 to 21 who are aging out of care of former CFSA, who are aging out of care, or former CFSA foster youth within 5 years of aging out of foster care who are applying for career service positions with the district government. This bill, I believe, is referred to our committee, and we will be acting on it very, very soon. When the district intervened in the lives of these youth and determined that their situations warranted removal from their homes for their protection and well-being, the D.C. government took on the responsibility in loco parentis for playing the role of the parents. Included in that responsibility is ensuring that youth who leave our care do so as fully equipped as possible with skills and opportunities they need in order to be self-sufficient, successful adults. Second, we must ensure that youth and families involved with CFSA have access to good, solid mental health and substance abuse services. I was very concerned with the mayor's proposed FY12 budget that would have eliminated the MOUs between CFSA and the Department of Mental Health and the Department of Health Addiction Prevention Recovery Administration. I am pleased to have found, from a mixture of vacancies and RIFs, $400,000, which meant the continuation of the Family Treatment Program that has provided drug treatment to 26 women whose children entered foster care as a result of drug abuse. Additionally, our committee directed $500,000, I think principally from vacancy money, if I remember, that be added for mental health services for children and youth committed to CFSA. This funding has been used to increase the children receiving a range of evidence-based practices and community support and interventions, including family-focused cognitive behavioral therapy, parent-child interactive therapy, and child-parent psychotherapy for family violence. In addition, we were able to find $100,000 to maintain the tutoring efforts and mentoring efforts, which had been pointed out to us was so important. Third, we must support child abuse and neglect early intervention and prevention efforts by increasing access to specialized services for at-risk children and their families so as to avoid entry into care and reduce reentry of families into care. This committee has long supported the implementation of a differential response system. Under this best practice approach, families identified as being at low or moderate risk of repeat maltreatment are given the opportunity to participate in an assessment as opposed to an investigation, and voluntary services to address their needs. In June 2010, the Council enacted the Families Together Amendment Act, which gave CFSA the authority to pilot this approach. I am pleased that in September 2011, the agency has launched its differential approach initiative, partnering together, and we'll hear more about that today. Additionally, I strongly believe that the Grandparent Caregiver Program is another valuable prevention program against family involvement with CFSA, and it should be protected. This is a very tiny amount of budget in the D.C. government's overall financial situation. But there is terrific impact as a result of this, and I was very concerned, and I remain concerned about the impact of a 33% reduction to the Grandparent Caregiver Program subsidy that was implemented in January 2011. I continue to get calls from grandparents who are struggling to make ends meet. Recently, we have been informed that we have a $250 million unanticipated revenue, a surplus for FY 2011. And there were immediately calls to repeal taxes. Did you hear that? Immediately there were calls, we should take back the higher rate, which was a restoration of a higher rate on the highest incomes of the District of Columbia. What I said in response was, we should restore the cuts that were made in the safety net. And because if we have additional dollars, we cut these programs on the assumption that we had an impossible budget situation that required these programs to be cut. And now that we find out that we don't have such a situation, I think we need to re-examine the cuts that have happened in this area. We did restore $300,000 in the FY12 budget for the grandparent subsidy program. And that was used to actually eliminate the waiting list at that time, which was good news. But it's clear to me that we need to do more to let people know about this program, because we've reached the point where, we've eliminated the waiting list, we now have some capacity available to us, but the fact of the matter is a lot of people don't know this program is available, and we need to do it. For the majority of grandparents involved, this subsidy is a vital part of their household budget. In fact, many reported that the subsidy allowed them to cover the cost of providing adequate food, utilities, transportation, clothing, hygiene items for their children, their grandchildren, thus the essentials of life. National statistics indicate that about 500,000 grandparents are caring for their grandchildren while themselves living below the poverty level. For many grandparents in this program, the subsidy is an absolute essential. Finally, efforts must be taken to increase the number of kinship placements when a removal occurs. And of course, the grandparent subsidy fills that function in a very, very fine way, in my opinion. Additional work must be done to ensure that there is a process in place to quickly identify, approve, and support kin placements. The agency must strengthen efforts to engage and identify such placement options in pre-removal family team meetings, which is an area that the agency also recognizes needs improvement. During today's hearing, I want also to discuss CFA's involvement with the development of the Peaceaholics Strategic Housing Intervention Program. Last October, I became aware of a $5 million program in the Department of Housing and Community Development designed to provide 35 homes located in 3 different locations for at-risk youth, mainly CFSA and DYRS youth. The program was supposed to have been a partnership between the Department of Housing and Community Development, CFSA, DYRS, and Peaceaholics. Now I've reviewed hundreds of documents and over 150 emails, and it's clear to me that while well-intentioned, this program had serious flaws from the beginning. Very quickly, the project was hijacked by persons motivated solely by personal profit, not the kids that it was supposed to help. Today, my reports are that only 7 of the 34 units which have been now rehabilitated are occupied. Now, I've got to say, and I acknowledge the presence of Council Member Michael Brown, who chairs the Housing Committee, but I've got to say that when last year at this time, when we were examining issues of housing for at-risk youth, in the hearings of CFSA, Ms. Donald, you weren't here then, I know, but in the hearings for CFSA, the hearings for DYRS, no one mentioned that this program had been contemplated and had recently been changed. And this is, to me, more than just an oversight, because we have a critical need, in fact, for this type of housing for at-risk youth, for foster children aging out of the foster care system, for DYRS wards, who today we are spending $34 million annually to send to secure facilities outside the District of Columbia in Utah, Ohio, South Carolina, though South Carolina doesn't want any more of our children, apparently, and other states. And so when all of this was happening, when we were concentrating so much effort in this, here was a program that was actually rehabilitating apartments at the very same time, and no one mentioned this to this committee. And it was only until months later, when I was conducting the hearing on the audit of the Peaceaholics funding, that this came to light. So you can imagine how upsetting this is to me, because maybe, just maybe, a year ago, we might have been able to salvage some portion of this program for its intended purpose, because in fact it was not redirected until February and March and April of last year. Now I want to acknowledge, so we're going to be talking a little bit about that. I want to acknowledge the presence. This will be the first time for Brenda Donald, not the first time ever, but the first time in her current capacity to be here at our hearing. She is the mayor's nominee for director of CFSA. We welcome you. You're a truly seasoned hand on all of these issues, having been several careers ago the director of CFSA, and since then had that responsibility and other responsibilities in D.C. and in the state of Maryland. We have just received your nomination. I think it was yesterday or the day before. So we'll be convening a hearing very quickly, and we're certainly delighted that you're here today. And we look forward to really working with you and taking advantage of all of your expertise and experience in this area. So, first, I have already acknowledged the presence of Councilmember Michael Brown, and let me call upon him for his opening statement.
Thank you very much, Mr. Chairman, and I cannot thank you enough for the leadership you've shown on these particular issues, and in particular, ones that include the fights that you and I are often in battle on the same side on saving some of the safety net issues here in our city, which include obviously helping the most vulnerable folks in our city. So I want to thank you for your leadership with that, Mr. Chairman. On a note, before I put my opening statement out, on Monday we will be having our oversight hearing on DHCD. I'm sure you'll be joining us for some of that related to some of these troubling transactions that you and I discovered in the last couple of weeks. As you probably know, Chairman Graham and I referred some of these troubling transactions and what was going on to the Inspector General's office and to the Attorney General's office for further investigation. So we will obviously keep you abreast of that. But, Mr. Chairman, I wanted to let you know, which I'm sure you already did, about our hearing on Monday. Again, thank you, Mr. Chairman, for hosting this oversight hearing on your continued leadership on these particular issues. CFSA is clearly a critical agency for some of our city's most vulnerable youth and as much as in need of close monitoring and strong support. Unfortunately, just so you know, Mr. Chairman, I'll be in and out of this hearing, but I will definitely be back for Ms. Donald's testimony. I'm sure you're happy to hear that. And so I'll be back later in the afternoon to see you. Some of the things that I'll bring up are some continuing concerns that we've all had related to this agency going back to the prior administration, and these are things that haven't quite been fixed yet. And these are issues such as the willingness and the capacity to go after all federal funding where we are eligible, the agency's support of successful prevention programs such as the Grandparent Caregiver Program and the Rapid Housing Program. Just so you know, a couple years ago, Chairman Graham and I fought to restore some of those dollars to the Grandparent Caregiver Program. We're proud of that. The agency's implementation of the differential response pilot program and how we can expand that program to scale. The agency's willingness or ability to find savings within its own agency rather than continuing to pass those cuts to the service providers. I'm sure there's some service providers in the room that like to hear that. The willingness and ability to for a provision of health and mental health services for our foster youth. The agency's ability to successfully prepare our older young folks as they continue to age out of the program and of the system. The agency's high rates of short-term and youth removal from their families and its ability to successfully get foster youth into kinship placements. So while we understand that the legal mandates sometimes narrow the scope of the agency's perception of its mission, I strongly believe that we must still strategically and proactively serve this particular population. It seems we're always in a reactionary mode rather than a proactive mode, and that's always a little more aggressive if we're doing things on the front end. So I'm confident under the new leadership of Director Donald that we'll begin to make great progress on these issues that I've mentioned, and there's so many others. So already we've heard that Ms. Donald has started out by reviewing the agency programs and is already meeting with the incredibly talented and knowledgeable advocacy community. That's important that you do that because if you don't return their calls, they call us. And then we have to call you. So I'm glad you're already proactively reaching out to the advocacy community because they have so much knowledge about this stuff and they're on the ground, as you know. So by getting a full understanding of these particular issues and meeting these issues head on rather than falling back on the kind of reactionary and status quo kind of systems that we've all been accustomed to, I look forward to the leadership of Ms. Donald and Mr. Chairman, your leadership in this particular hearing. And again, I'll be leaving in a little bit and watching some of the testimony on television, but I'll definitely be back for Ms. Donald's testimony. Thank you very much, Mr. Chairman.
Thank you very much, Councilmember Brown, and I do want to acknowledge very sincerely the work that we have done together on this housing program for at-risk youth. And we're not done with this by any means, and hopefully there will be some meaningful use of these apartments for the children who could really use it, the children and young adults who could really use it. I just want to recap that this committee did redirect $1.3 million in funding last year in a very, very tight budget situation. In fact, and I don't know whether I'm pleased or not pleased with this, but it's a fact, but this was the only committee to recommend the elimination of positions with individuals in the jobs. Only here were those cuts made in the entire government of the District of Columbia. And by doing that, we didn't say which positions should be eliminated, but we relied upon the judgment of the leadership of CFSA to make those judgments, but in fact that did happen. In addition, we also recommended, in addition to that $1.3 million, we recommended the transfer of $500,000 from the Office of Youth Empowerment on an issue that had been the subject of a lot of discussion before this committee, and I'm very disappointed that it didn't happen. And I don't know why it didn't happen, because it was adopted by this committee, it went forward, it was accepted by the Council in the Budget Request Act. There was something that happened to this direction So we have to now reassemble ourselves on this with a new determination, because the rationale is still the same in terms of what we have in mind, to move from the Teen Services Program to Youth Transitional Living Contract. And so, but I am also going to get to the bottom of just who decided to ignore our recommendation, because somebody did, and it didn't go forward. So for those there are probably people here today on that issue. I'm sorry that it didn't happen, but we'll make sure it happens this time, because our views on that are still the same as they were last year. So we have a panel on foster youth, but I don't think they have arrived yet. Does anyone know? No? Well, when they can come and testify. So we go to witness number 9, Judith Sandalo, Executive Director, the Children's Law Center. Dr. Amiglo Boone, Executive Director of the Consortium for Child Welfare. Dr. Boone, I know, is here. Richard Flintrop is here. From the Healthy Families, Thriving Communities, a Collaborative Council. Debbie Shore from Sasha Bruce, I don't know, she's represented. Deborah Shore from the Sasha Bruce Youth Work is represented. If you have prepared testimony, by the way, please provide it to Mr. Cameron so that he can then provide it to the members of the committee. Did you give the testimony to Councilmember Brown? Okay. And, well, I'm going to try not to ask too many questions out of deference for the large number of witnesses. So please don't think I'm not interested in what you're saying, because I'm very interested in what you're saying, but I think that we'll move more efficiently if we can just limit the number of questions that we're asking. Judith Sandalo, your testimony, please.
Good morning, Chairman Graham, members of the Council, Mr. Brown. As you know, my name is Judith Sandalo. I'm the Executive Director of Children's Law Center and a resident of the district and a proud resident of Ward 1. I'm testifying today on behalf of the Children's Law Center, which is the largest nonprofit legal services organization in the district, and the only such organization devoted to a full spectrum of children's legal issues. Every year we represent more than 1,200 children in the district, including 500 children in foster care, dozens of children at risk of entering foster care, and several hundred foster parents and relatives of children in foster care. As you know, this has been a year of significant transitions for the Child and Family Services Agency. Director Roe K. Gerald left at the end of May 2011, and Deborah Portia Usher stepped in as its interim director until this January, when Acting Director Brenda Donald rejoined the agency. Even with these transitions, the agency made important progress. Last year, we came to this committee urging significant reforms, several of which were achieved during Deputy Director Portia Usher's leadership as interim director. We called for differential response to be implemented, and CFSA launched that pilot project in September. We urged CFSA to lower barriers for kinship placement, and CFSA issued policies doing exactly that. We urged more transparency with regard to rulemaking and policies, and CFSA has begun to share certain policies for comment. It is encouraging, Mr. Graham, that even during a challenging year, CFSA made strides in the right direction. Acting Director Donald comes back to the agency with a strong knowledge of both child welfare and the district, and while only in place for slightly more than a month, she has started off on the right foot by reaching out to the community and understanding the role that community partners play. We look forward to working with her. Despite the important changes last year, however, if DC is to have a successful child welfare system, it must institute reform at pretty much every step of the process. On the front end, the government does not adequately prevent abuse and neglect, and CFSA does not do a good enough job keeping children safely with their birth families. Once CFSA removes children, it does not serve them well in foster care, and they stay in foster care too long because CFSA fails to reunify with their parents or find alternative permanent placements. These problems have existed for many years, and while the agency has made progress, the problems are far from solved. I go into much greater detail in my written testimony on the suggested reforms and some of these concerns, but today I want to focus briefly on 3 programs. I'm sure I'm only going to have time for the first one, which is differential response. The others are children's mental health and rapid housing. All have significant implications in the FY13 budget, and I think they are all worthy of investment, both for short and long-term benefits for families and the district's bottom line. As you know, we worked very hard with the Council and the agency to create legislative change to allow CFSA to begin to implement a better model differential response. They have begun to do so, and one of their major accomplishments this year was to implement that program Between September and mid-January, 97 families were referred to this program rather than for formal investigation. There's an urgent need to expand this program. CFSA estimates that nearly 300 additional families who came to CFSA's attention this fall might have been appropriate candidates for differential response had the agency had the capacity to serve them. We want to urge that CFSA be given the support and the funds to expand and make this program successful and to build on the district's strong capacity and strong families. I cannot overstate the importance of providing prompt and effective mental health services to children and families. Providing these services can help families better manage children's behavior and avoid the need for foster care. Failing to do so can lead a family's relationship to deteriorate to the point of danger to a child. Providing mental health services can help children heal from abuse and neglect and reunify safely with their families or leave for permanent families. There has been modest improvement in some aspects of mental health services, but overall there are troubling indications that many children's needs remain unmet. It appears that the proportion of children in foster care who are receiving the mental health services that they need may have decreased over the past year, resulting in an increase in psychiatric crises that precipitated hospitalizations. It's clear that additional resources, supports, and services are essential to improve district's children's mental health program and outcomes for children and families. And finally, Rapid Housing, which one of our favorite programs because it is a small but extremely effective program which helps families stay together or reunite and helps older youth. In FY11, 449 children benefited from Rapid Housing. For 278 of those children, the funds were used to preserve them with their families rather than bring them into foster care. Both good for children and a great cost savings to the district. In FY12 so far, 367 children have already benefited from Rapid Housing Awards, including 319 for whom the funds are going to preservation efforts. We're glad the program is being successfully used, but we are concerned that the program may run out of funds before the year is over. We hope that funding is made available to serve all eligible families. Mr. Graham, thank you for the opportunity to testify, and I will be happy to answer any questions.
Thank you very much, Ms. Sandler. Let's proceed down the panel before we ask any questions. Encouraged, however, by the nomination of Brenda Donald, are you not? And where do you think she should be focusing in on as the highest priorities for her first year in office?
I think she should be trying to narrow the door, I think is the phrase that she likes to use, which we support, which is keeping kids out of the foster care system by both strengthening prevention, differential response, and making it easier for children to live with kin. I think if she does that, then what limited resources we have can be focused on the kids who really do need to come into care. And there's a wealth of ways in which she can narrow that door, and I believe it is one of her highest priorities.
Encouraged, in terms of all of your testimony, in terms of, what did you say, narrowing the door? Is that what it is?
I believe it's Ms. Donald's phrase is called narrowing the door.
Narrowing the door. It would seem to me, and I felt this way last year, I know Councilmember Wells would agree with this, that a no-brainer in this regard is the grandparent care program. And, and I've never understood how such a tiny amount of money that achieves so much in terms of keeping kids out of foster care and keeping them in a kinship relationship has been as controversial as it is. I mean, not that, in tight budget times you don't look for various programs to find dollars, but is there any light you can shed on that for me? I mean, why is it that we seem magnetized by this little program that does so much good? It has not been the subject of a lot of abuse, as best I can determine. If any abuse.
None, no.
And we had grandparents here last year at this time and provided incredibly compelling testimony. Can you shed any light on this for me, why this is so controversial?
Mr. Graham, I believe it was a game of political hot potato where children were the hot potato, and I don't believe that Ms. Donald will be playing that game. I believe prior directors were confident you would restore the funding, and so they chose to cut it in order to force you the council to restore the money and not make other cuts in their agency. I think it was a very dangerous game which hurt children, but I don't believe that we're going to see that again this year.
Well, I hope not. I hope not, because, in fact, what we need to do at this point, and we have testimony coming from CFSA on this issue, we need to revitalize this effort, because I believe we have excess capacity at the moment because we maybe weren't doing very much to attract people into the program. But we all know the need is terrific and obvious.
Mr. Grant.
And you can have all your presentation right. You can have a resume built. I don't know what kind of resume people have at the age of 18, 19, and 20. I don't know. I don't remember me having much of a resume. I wasn't a foster care child, but I don't remember having a resume to speak of. So you understand the point I'm making, that, I just don't know I don't know why this is not already happening, and I don't know whether this is the best use of the limited dollars.
Mr. Chairman, I don't know whether it's the best use of the dollars, but I do think that it ties to the problems that Ms. Donald is coming in to fix. So many of these youth are not living in foster homes where they have, or kinship homes, where they have adults who can model and show them what to do. And the reason they're not living in those homes is because CFSA, unfortunately, has a long history of not doing a good job of supporting the foster families to work with youth. And so obviously most of us learned our job skills from the adults who were taking care of us. And so I think CFSA needs to work on that piece of things, at which point subsidizing jobs and your very interesting bill that you announced will make a difference. But right now we do have a gap because our kids are not being provided with some of the most basic skills.
I would like